Good morning. Welcome to the Chanhassen Library. I am Linnea. I am the Adult Services Librarian at our library, and I have some announcements before we begin with today's program. Today's program is being streamed simultaneously on Carver County Library's Facebook page, and it will be available on all of our social media soon after the program. This program was made possible by the Chanhassen Communities Belonging group of local volunteers. Raise your hands. And they host multiple programs every month, and you are always all welcome. Flyers about all of the Communities Belonging fall programs are on the tables at the back of the room and next to the information desk inside the library for those who are watching live or are recording. You can also find information on the library's website and cobchan.org. That's C-O-B for Communities Belonging, chan.org. Some upcoming CHANforums on second Saturdays this fall. On October 11th, our next one will be a open mic. It's our third time having an open mic for all ages. You can sign up online if you would like to share a poem or a short prose piece, your own or a favorite, with a warm and supportive audience. No experience is required. Then, on Saturday, November 8th, November is National Family Caregivers Month, and local author Heather Durenberger will lead a forum to delve into the emotional, physical, and logistical challenges faced by adults who simultaneously raise children, manage careers, and care for their aging parents. And this program is based on her book, Thriving in Chaos, which will be available for purchase and signing. And as a bonus, attendees to that program will receive access to an exclusive Living in Chaos Companion workbook in PDF format. And of course, all library programs are free. If you have not yet seen the recording of our July CHANforum called Look for the Helpers, it is on the library's Facebook page and also linked from the website cobchan.org. And so far, the recorded program has been viewed more than 2,100 times through various platforms. Speakers from the Carver County Public Health Department and 11 local nonprofits each spoke about their urgent needs to help others in our community. You can watch the program to see how you can help your neighbors. Also, be sure to pick up the library's fall program brochure, which lists all of the free programs at all of the Carver County Library locations and online from September through November. And we hope you will visit your public library often. After today's program, please take a moment to fill out a brief survey, just a few questions, to tell us about what you thought of today's program and to give us the ideas that we will use to determine future programs. The survey is anonymous, and you can leave it in the basket on the back table for those in person or stop in if you are watching online. Finally, I am pleased to introduce today's forum topic and speakers who are all here as volunteers this morning. We thank them for sharing their knowledge, their time, and their talents. Emergencies happen. The more information we have, the more we can respond safely and effectively when they do. Later, we will hear from Chanhassen's Fire Chief, Andrew Hager. But first, please join me with a warm welcome to Kara Cassidy and Jess Jones from Carver County's Emergency Preparedness team.
Good morning. My name is Kara Cassidy, and this is Jess Jones, and we're here from Carver County Public Health, the Emergency Preparedness team. Today, we're going to talk a little bit about emergency preparedness. So, this is not my forte. There we go. All right, a quick overview of our agenda. We're going to talk about Carver County Public Health and emergency preparedness. Then Jess is going to step in and talk about preparedness for older adults using a great resource from FEMA. And then we have 2 practice scenarios we'll go through, and then a little bit about how you can get involved and stay informed. First, There's always a big question, what is public health? That's going around as we see a lot of cuts to public health departments around the country. So I'm going to tell you a little bit about Carver County Public Health. Our mission is to partner with our community to assure, protect, and improve health and well-being now and into the future. I've listed some of the things that we do at Carver County Public Health, such as public health vaccine clinics. I do our Office of Aging, where every month I visit 5 cities in our county that all have commissions on aging that inform their city councils on issues that affect older adults in Carver County, where our fastest growing population is 65 plus and 85 plus. We do nurse home visits. We have public nuisance intervention, tobacco prevention and education. We have one of our colleagues who does responsible server trainings for businesses, restaurants in the area on both responsible service of alcohol and cannabis products. We do food distribution and produce markets. Those are year-round. Jess is our lead on that now, and during the summer we have a few more, but they do continue throughout the year. We are part of the statewide Health Improvement Partnership, and believe it or not, our communities of belonging grew out of Carver County Public Health. So we're really proud of this event and for all of the volunteers who are taking this work to their communities and really championing how we can all come together and get to know one another and build strong communities. We do disease prevention and control. You probably saw us during COVID. And then the reason we're here today, emergency preparedness. So what is public health preparedness? We are different than emergency management. You're going to hear from the chief later on, and typically you call 911, public health doesn't show up. We have our emergency management and first responders who come and help you, and then if there's a component that we need to set up a shelter because a tornado has perhaps gone through a neighborhood and now people don't have someplace to live, a disease outbreak, something like that, then public health will show up and help you out. I'm going to read this. In the United States, we have a thing called the National Preparedness Goal. And the National Preparedness Goal is a comprehensive framework that aims to ensure the entire community is prepared for a wide range of disasters and emergencies. It defines the target level of preparedness necessary to protect against, mitigate, respond to, and recover from threats and hazards that pose the greatest risk. There are a lot of people that you don't even understand. We are continually preparing for an upcoming disaster. How do we respond? How will we recover? How will we help those who are most affected by the incident? This is part of the emergency preparedness goal. We have prevention, mitigation, preparedness, response, and recovery. And it's ongoing, as you can see. Once something happens, we learn from that and we start preparing. And it just keeps going and going so that when someone has a bad day, we're there to help. So a question is, what is a public health disaster or emergency? A public health emergency is anything that causes or could cause injuries or illness to a large number of people. An infectious disease outbreak such as COVID, toxic chemical radiation bioterrorism, natural disasters, severe weather or power outages, and mass casualty incidents. Lots of times when events happen and you might need some mental health assistance, public health is there to help you out. This is scary stuff, I understand. Sometimes we go, I spent 3 days at a training this week, and one night I didn't sleep because I feel very responsible that I'm going to help my community. But we also need to get out into the community and let everyone know that you need to be prepared for 3 days to be on your own. Because you're not going to be the only one calling 911, so is everybody else. And in the meantime, they're trying to put out the fire or rescue people from flood. So it's really important that we prepare for disaster and are able to take care of ourselves for a little bit of time. Oops, I went. So why do we talk about emergency preparedness for older adults? Emergency preparedness is for everyone, but I'm now in the 55 plus category, so I'm considered an older adult in Chanhassen and Carver County, and we tend to be higher at risk just because we may have more medical conditions. Perhaps we can't run away from a disaster now. We have a few more mobility challenges. And perhaps we don't have the money to stock 3 days worth of food. There are several things that we have to consider as we age so that if you have a bad day, you're ready to go. Now, Jess is going to talk about a great resource from FEMA.
So if you already have one, great. This is the handout I'm going to be walking you through. If you don't have one, we do have some more on the back table along with a bunch of other materials. So feel free to grab whatever you need. Feel free to grab some to share with family, friends, anybody you think might need these. They're also available online too, so you can go to FEMA and find these documents online as well if you want to share them digitally or have an extra copy at home. So I think it's really helpful to know that you can get prepared. You can do some things to make you feel more confident, more secure, more ready for these events, right? So if you do a little bit now, it's gonna have a big payoff when something happens later on. And even if nothing happens, these are great things to do to make sure that you feel good about all your resources and you feel secure for any event that might happen. And if it doesn't happen to you, it might happen to a friend or another family member, and then you would be the one that's prepared to assist them, right? So it's really important to think ahead and take a little bit of time for a lot of help later on, right? So we have 3 steps we're going to go through. The first one is to assess your needs. What support would you need during an emergency? What resources do you have? What hazards are there in our community, right? What is the potential emergency that might happen? The second step is to make a plan, get that together, share it with your family members. And then the third step is really, really important. It's to engage your support network. Our support networks are invaluable, and it's really important to invest in them and communicate ahead of time so that when something happens, you can leverage that resource. So our first step, you're going to find it on page 4. This is going to have a checklist that will take you through what to think about. So you don't even have to think about it. You can go through this checklist, go one by one, and just think about if this applies to you, what you would need. There are some general considerations and questions you can ask yourself. So some of those might include, do I have any medical conditions or dietary requirements that require specific care and medication? What mobility challenges or disabilities do I need to plan for? If you have pets, what extra supports would they need? How would you transport them? Make sure they have food, water, all of that. And I think the biggest thing to think about is this would be, in an emergency, would be a very large disruption to your normal routine. I'm very routine-based. That's very hard for me to think about, right? I do the same thing every day. Makes me feel good about it. I know I'm getting my checklist done. So you just want to think ahead, like what's going to be a big hurdle for you if that does change. Our second step is to make a plan. You're going to find that on page 7. This also has a really good step, a checklist and a list of what you might put in your emergency kit. So for creating a plan, the first thing you want to think about is, again, that support network. You want to make sure you know who's in your support network, who are you supporting, and who is supporting you. How do you reach them in an event of an emergency? You want to create a communication plan. This is really important to talk to them directly about it so they are on the same page with you. If your cell phone's not working, how do you get a hold of them? Or if the internet's down, etc. How are you going to communicate with them? Do you have their numbers on hand? Are they easy to access? I can't remember all my phone numbers I need to know, so it's good to write them down, right? You want to make sure you have a point person in your life. Who's that person that's going to have the keys that can come into your house in the case of an emergency? Maybe you're not home, maybe your pets are. They can go take care of them, right? Or maybe you're having an emergency inside your house, but they can come in and help you. So it's really important that somebody in your life has some extra keys. Again, if you have pets, you want to make sure you're prepared for them ahead of time. So what do they need? If you want to have a little kit, I have some food set aside for my pups and for my cats. And then I have some crates on hand if I needed to transport them. It's still a challenge, but at least I have something ready for them, right? I'm not starting from scratch. The last step is really important, is to create your emergency kit. This can look like a lot of different things. So I'd love to hear, we do have a checklist here, and we have this wonderful handout in the back that gives you some examples of what might be an emergency kit. These are things that you would need to have on hand for, what Kara said, 3 days, right? So really important stuff. You want to make sure they're ready to go. Does anyone here have any examples of what they might want in their emergency kit? Yeah.
I learned that having a towel for the pet, because the pets are going to be freaked out, and so they'll be scratching. And if you wrap them in a towel, you can hold them easier when an emergency is happening.
Absolutely, that's a great one.
Can you repeat that for the microphone?
Absolutely. So we're wondering if anyone has, the answer. She said a towel would be really helpful for your pets to keep them calm, to wrap them up or put them over the crate, right, to make them calm and feel secure in the situation of emergency. Any other examples of something you might want in your emergency kit?
Chargers.
Chargers, yes. Maybe one of those like charger blocks that have a charge on them so you can plug that charger into it, right?
Toilet paper.
Toilet paper? Absolutely. It's always good to have it on hand.
Lights.
Yes, absolutely. Lights, right?
I'm going to add any extra medication or batteries if you have durable medical equipment, and glasses. Like I wear contacts, and at some point I'm going to need my glasses.
Absolutely. So other examples I'll pull are our first aid kit. We do have little mini ones in the back if you want to grab those. I encourage you. Those are really good for on the go. But to make a home first aid kit. So I have a drawer in my bathroom that I just put a bunch of different medical supplies in. I have on hand. I know what's in there. I know I need to restock it. It's really good to have. Then you don't have to think about it. Other things that are good to have, maybe copies of your medical documents, anything you might need on hand, making sure they're in maybe a waterproof sleeve, something that won't get damaged. Water, right, is really important to have on hand, so maybe some extra gallons you can pick up at the store when you can. Any other ideas for what you might want in your emergency kit?
A boat.
A what?
A boat.
A boat? That would be handy, right? Yeah. All right, cool. And again, it's really important to think about how do you tailor this to you. So there's this checklist that's great. You might not need all these things, or you might need additional things. So think about, again, that first step, assessing your needs, making sure you've considered everything you might need in an emergency. And don't be afraid to reach out, ask us questions if you need some support in putting that together too. The third step, and arguably one of the most important, is to engage your support network. So in an emergency, we're really going to rely on our neighbors, our family, our community members, our friends, anybody in your life that you regularly interact with that might be able to support you. It's really important to be interacting with that group ahead of time, making sure that they know the plans that you have, share that plan with them, talk it through, make sure it works for them, that they have it on their plan as well, right? And then if you do have medications, I know I think about this, you know, if there was an emergency, how would I make sure I have a refill? How would I have enough in that situation? So you could talk to your pharmacist and see if they have any information on how much additional medication you could have on hand. You want to make sure you're thinking about expiration dates. They do expire, right, and they become less effective. So what I do is I keep a little go kit in my bag for work if I forget something in the morning, and I cycle it out. So I just make sure that doesn't expire. I do use it. So just want to be mindful of that. And then Kara has a really good story that really helps illustrate the point of this.
First, I want to say for those who are online, the resource that we are talking about is available from ready.gov, and it is called the Disaster Preparedness Guide for Older Adults. And it's still there. You can download a PDF of that file. So there was a study done in Japan, which is a country that often is prone to natural disasters like tsunamis, and they looked at two different cities. One city decided that they were going to build a 30-foot wall around their city to keep out all of the water when the next tsunami came. And these houses and businesses that had an ocean view all of a sudden had a great big wall in front of them. Then another city decided that they were going to invest in their community. They were going to do more community events, like community of belonging, get to know your neighbor, and start doing things together as a community. Well, lo and behold, a tsunami hit, and guess what happened? The water went over the wall. That community, the only thing they did to prepare was build a wall. So they had a large loss of life, and they had a really hard time recovering because their only plan was the wall. Then there was the community that didn't build a wall. They invested in social capital. They invested in their community. They invested in getting to know their neighbors. They had a very low loss of life, and they recovered quickly. So it just goes to show you how important it is to belong to a community, to get to know your neighbor, so that when a bad day happens, there are people you can reach out to and people who will check in on you.
Absolutely. Thank you, Kara. All right, these are some preparedness tips. So I think we could start investing in advance. So you want to think about, again, what are your needs? What are the hazards we're facing? You want to make sure you're looking up, where do I go in the case of emergency? Who do I contact? What radio station do I go to get the latest information? So our local one is 162.55. It's important. On the NOAA radio, thank you. So it's important to have those numbers written down. So I keep like a little notebook like this, and I write all my numbers in it, so I remember them. I only remember my mom's number by heart, so I want to make sure I have everyone else's down. It's good to have emails, you know, local places to contact written down too, so you don't have to look them up on the fly. If you have a medical condition, it's helpful to have a medical bracelet that can help, you know, responders communicate what needs you might have. You have those extra prescriptions, those extra DME batteries, durable medical equipment batteries, and again, if you can prepare food for 3 days, great. I know it's really hard to buy extra food, especially right now, and so one suggestion we have is when you go to the store, just buy an extra can of something. Just buy one little thing each time and start stocking that up. I keep a lot of beans on hand because I eat a lot of beans, but that means I have a good resource of them on hand. I just cycle them through so they're not expired. You want to think about, what do you already have on hand? What could you use? Again, if I already have a bunch of beans, I don't need to buy more, right? And you want to take advantage of those sales. So if you get some good coupons or see some sales, buy some stuff you wouldn't normally buy and just keep it in your pantry and know that it's on hand. It's good to have that go bag on hand, so maybe packing some extra clothing, those documents or other things on that bag and have it ready. Or you can just know where it's at in your home and have a bag that's designated for it to put it into, because you might not need the same thing every time, right? You just want to know where it's at, know that it's ready to go. And I think it's really important to not be afraid to ask for support. Again, that's how we get through these events, is asking each other for support and help, communicating our needs, be persistent. Sometimes people are really moving quick with their mind in this situation, so be really firm in letting people know your needs and what you need to feel good in this situation. Does anyone else have any other ideas for preparedness tips, things that might make them feel more prepared for emergency? Yes.
There was the message mentioned having like a whistle.
Yeah.
And of course, most people have it like on a lanyard. So I have so many dogs who have passed away. So all it has my name, my address, my phone number. Clip one of those onto it too.
Yeah.
So if you float away somewhere, you maybe would have that on you. Or I know this sounds awful, but those poor kids that were in the flood,
Yeah.
the counselors had written their name on their arm. You know, if you're like in your car and the river's rising, something like that, and I don't know, it's kind of ideas that you would never really think of.
Yeah.
But some will have your ID on you without, like, in your purse, have it somewhere on you, so
Yeah.
just kind of thinking of that.
Absolutely.
That's a great idea to have a whistle or some identifying thing with you. What I just learned in a recent training is during emergencies, a lot of people just drop all their stuff and run. And there was one large incident where the FBI, they return materials to you if you're at a large event and something bad happens, and they had 6,000 of the same cell phone to return to their owners. And and they returned a lot of them. Some people just never came back to get them. But it's important to realize that when we panic, all of us, it's more common for us to just drop everything and go. So if you have a go bag that has some your important papers in it, or some identifying information, then you'll always have something with you.
So
Yes.
then in your phone, in your cell phone, it'd be a good idea in your address book to just put in me,
Yeah.
your phone number.
Yes.
And then if somebody finds your phone, they'll go, oh, look, here's one that says me.
It's funny, I have me in my cell phone. Linnea, did you have a?
Just making sure you repeat for the online.
Okay, yes. So the comment was, it might be important to put your own cell phone number in your cell phone as a contact, so that if someone finds it, they could possibly.
Well,
Yeah.
they'll call it, and then your phone will ring, but they could leave a message on your voicemail.
That's
that you
right.
can access from any phone.
That's
So
right.
it's not redundant to put your own number in your own.
That's correct. That's correct. You could get a voicemail.
Right.
Yes, no matter where.
One of our online viewers suggested having a road map.
Oh, having a roadmap, that's a great idea.
Absolutely.
Because as if you're old enough and you remember 911, all the cell towers went down. And so there was no way to use a Google map or use your cell phone for navigation. So sometimes some of the old school ways that we think about, like you remember driving around with the big atlas in your car? It's not a bad idea to have something like that.
Absolutely.
I want to add too, a plan for family members that might not all be together.
at the same time, like for students at school or parents who are somewhere else.
Yes.
Right, so a plan for family members who aren't all together, kids at school, perhaps a meeting place
Yep.
where if it's a bad day, this is our plan. So that's a good one. Yes.
One thing that I realized when we had like a 2-day power outage last summer in Chanhassen was I still have an old school radio with batteries. And I didn't have TV, I didn't have the internet. My phone, I could go and charge it in Carver or somewhere else. But it was really nice just to have a radio that was battery operated that I could turn on.
Yeah.
You know, in addition to flashlights and, battery operated lanterns. But a lot of people got rid of all their old school, radios.
So we had a comment that during a power outage recently, it was really important that to have just an old radio around that battery powered radio, because there was no power and you could get information from the radio. So that's a great idea. And there are crank radios and weather radios that are available. So great comment. Did you have a comment over here?
Yes. A knife, a lighter, and matches.
Oh, that's all great. A knife, a license, and
Lighter.
a lighter. Yes, those are all great. Great
Absolutely.
ideas.
Yep, and they make some waterproof matches too. I used to teach outdoor survival. That was one of our big suggestions. In the case of, a big weather event, a flood, you want to make sure things are dry and you have a way to light something. Great, great example. Any other ideas? All right.
We're going to do 2 scenarios of emergency situations. So here it is. Steve lives alone and is relatively mobile. One day he hears the tornado sirens go off, and as he starts to move to his basement, he slips. What should Steve do now?
Where is he? In what country?
In what country? In what country?
Japan.
Nope, he is here. He's living in Chanhassen, and he's at home, and but he lives alone. And he falls down. Any ideas of what Steve should do next? Get up if he could. Yes, that's Linnea suggests that he should call someone.
If he has his phone.
If he has a cell phone, that's correct. Any other ideas?
Well,
Oh, yeah.
crawl underneath the table.
That is a great idea. Make yourself safe. So Steve could use his cell phone or a medical alert device to call for help. He could try to move away from the windows, like under a table. And Steve should always be aware of the outside if he could, so he can assess his risk, because maybe he doesn't need to go under the table. But
He can use his voice.
he can use his voice. That's correct.
He could continue going to the basement.
Yes, if he's able, going on down to the basement is a great idea. So, being prepared before his slip helps Steve. He used his cell phone that he keeps in his pocket. He was able to get help and get somewhere safe before the disaster hit.
All right, for our next one, Marco has diabetes and lives with his partner Brenda and their 2 dogs. One evening in the middle of a thunderstorm, the power goes out in their apartment. What should Marco and Brenda do now? Yes.
Use a flashlight
Use a flashlight, absolutely. That would be helpful.
and a bunch of magnetic flashlights if he can by himself to turn off his house.
Yeah.
Absolutely.
Repeat.
Flashlights, and what was the other one?
To hang lamp on his house.
Lamps.
Yep.
Yep,
Put on
absolutely.
our old school radio.
Put on an old school radio.
Go to the stairwell level of a building since they're in an apartment.
Go on a lower level of the building since they're in the apartment. It's a good one. Yes?
Make sure that he's got diabetic medicine and also food.
Yes, absolutely. Yep. And some diabetic medicine needs to be refrigerated, right? That's going to be a big thing to think about in this situation if their power is out, right? Any other ideas?
Talk to their neighbors.
Talk to your neighbors. Engage that support network, right? That would be super helpful in the situation. Maybe somebody else's power is not out, right? It might just be your house or that apartment. Maybe someone in their family or their friends or that support network has a safe place they can go to with refrigeration. So they could use a cell phone to see if their power company knows how long the outage will last. Typically, you can find that on their homepage. They'll have an outage kind of, a frame that you can look at, and they'll give you some information on how long they expect it to be out, how long it'll get until that is repaired. They can enact their insulin plan. So they thought ahead, right? This could happen because they have a medication that depends on refrigeration, or might not, but they have a plan for it, so they're ready to go. They're not having to think on their feet and panic. They feel secure and confident. They've practiced for this, right? I think it's really important to think through, have a plan, but also maybe run through it with your family too. They could tell another family member about their situation, which our audience covered. They could find their emergency bag and portable chargers, right?
Linnea has a question.
What about their dogs?
What about their dogs? Yeah. Leashes. Yeah. I don't know about you guys, but some of my pups get nervous in a situation, so I love the towel idea, maybe providing them some comfort. Yeah.
Sometimes when you're going in and out of the door, you can take the leash and hook it under the couch leg.
Yeah.
And it'll keep the dogs inside.
That's a great thing to think about. You might need that door open in an emergency so you can go in and out.
Yeah, just put it under the couch.
So put a leash somewhere that can secure them so they can't run out the house. Now you have another emergency if they do, right? It's good to think ahead and make sure that they're safe and secure. Yes, please.
Do people that are in charge of associations for the townhomes and different living places, especially for everybody, do they ever talk to you or have a plan? Because we're trying to work just to get to know each other in our association. And it's pretty hard because we don't have phone numbers for people.
Oh, yeah.
Email addresses. So I guess I'm just wondering, I might give this information to our association. There's about 134 places there. And just find out, because I've been actually taping things to the mailbox. You know what I mean?
Smart.
People like to know about this. But it's a responsibility that every association should take.
I agree.
Pay their people and to inform them about the National Night Out. Just
Yeah.
like that. Get to know your neighbors.
Absolutely. It's a great point, and I think it really touches home with that support network, right? Like, it's a perfect support network. So the comment was, do neighborhood associations, apartment, townhome associations, do they have a plan in place? Do they communicate it? Do they have that resource network in place? And I think the question is probably, it varies, right? It's going to depend on the people that are in those positions, and if they are doing what you're doing, taking that effort, that extra step to reach out, that's a lot of work. So we really appreciate you doing that, and I think the more that it's done and the more that we advocate for that in our communities, the better we will be prepared, right? I think that's super important.
What about assisted living, memory cares, my mom's in memory care. I think they're pretty well prepared, but I don't know.
Yes, I think that a lot of them, they prepare for bad days because they happen more frequently than we like to know. And most of them do have plans for emergency situations. And the question was, what do long-term care, assisted living, and memory care facilities do?
Alrighty, so being prepared again before the power outage really helped Marco and Brenda. They had that support network, maybe they're able to reach out to it, they had all their supplies on hand, they're able to secure that insulin plan, right? So having that backup plan to keep his diabetes medication meant he didn't have to panic, right? If you could do a little bit of work ahead of time, you can feel more confident, more secure, less emotionally distraught maybe in this moment. Because these are taxing events, right? It's not fun to go through these things, so the more you can prepare, the better you can feel about it. So keeping portable chargers fully loaded and accessible meant they were able to keep access to the internet and communicate with family about the situation. So super important that those were in place.
So how can you get involved? If you're a person who's called to help your community, and this is something that kind of sparks your interest, the Carver County Medical Reserve Corps, also known as the MRC, is part of a nationwide initiative to recruit and train volunteers. They help their communities respond to all types of health disasters. They respond to both emergency and non-emergency opportunities based on their background. And they have the opportunity to attend optional in-person and online trainings that are mostly free, or I think they're always free. And the only requirement is that you live or work in Carver County and you're over 18 years old. This is the contact information of our coordinator. It's also on the Carver County website, public health website. Something you can do today is you can sign up. We have a QR code that's rotating in the back, or we also have paper copies. Linnea is holding one up in the back that you can fill out to receive the Carver County Citizen Alerts. So whenever there is a potential hazard, I signed up and I'm always I get a text, I get an email, I get a phone call. I must have clicked all the boxes because I know when something's coming, which is a good thing. We also wanted to let, that's the next slide, everyone know that the emergency sirens do go off the first Wednesday of the month at 1 p.m. So don't be alarmed if you hear that go off. Weather tip.
Awesome. So when you think about weather, and this is kind of crossing over into emergency management territory a little bit, but all of the warnings and alerts and notifications, they can get confusing. I know sometimes even I, in this field, am confused about what they each mean, right? Similar words, watch, warning, advisory, all these different terms. So we found this really fun graphic that we thought is very helpful to kind of break it down, make it easy to understand. So when you hear a weather watch, I'd be more specific than that, but we want to think about it as a taco watch, right? All the ingredients are out, they're on the table. Maybe there's going to be some tacos soon, but they're not together yet, right? So just letting you know, tacos are coming. So you want to get ready, and you want to think about those tacos. And then if you hear a warning, a taco warning, they're ready. They're ready to eat. They're here now. So you want to take some action, right? To get prepared, make some moves to make sure that you're in the space that you want to be in. You have the supplies you need. You've engaged your support network, etc. Just in case. I know we get a lot of alerts sometimes, and they can be overwhelming, or maybe you're dismissing them because you get a bunch of them, but it's good to think through it, be prepared just in case. That way you don't have to be thinking about it too much. Anything else for that?
I did just want to add, we have a lot of handouts in the back on different scenarios, power outages, thunderstorms, tornadoes, on what do you do. And for those online, those are also available at the ready.gov website. You can download it as an entire packet or just individual sheets. And so there are lots of different resources, or I have them all in a folder if you'd like to take a folder with you today.
All right, these are some of our main takeaways, but we'd love to hear from you. What are some of the takeaways you got from this, or just some, in general, emergency preparedness takeaways you have today? Yes.
That I need to get going and get this.
Yes, that you need to get going and get this stuff together, absolutely. But you got time, right? So we can do a little bit at a time, maybe one thing a week, whenever you can, right? Any other takeaways? Anything you'd add? So you cover it now is the time to prepare for an emergency, not after something bad happens. But we do learn and live moving forward from those, right? So if something happens, you can know, okay, I didn't think about that, and just kind of put that in your back pocket for next time. Be prepared. Be honest with yourself about what you need, right? You want to be really realistic about those needs and how we're going to meet those. And there's nothing wrong for asking for help, whether that's within this room, with our communities of belonging. Us at Carver County, you can reach out if you need support, your family, your friends, your loved ones. Ask for help. It's okay, and it's really the best thing to be doing. And having that plan encourages independence and eases family concerns. So it's really important to talk about it with your support network and run through it again. Maybe not a full drill, but just kind of walk through it, talk through it together. So it's not just something on a piece of paper. Yes?
Back in the day when you bought a billfold, it always had that little card in it, in case of emergency. And I'm not sure people are always filling that out and keeping them with them. And then back to the old cell phone, put in an entry that says emergency, and then the person.
Yes.
But, and then what happens if your cell phone locks and you don't know the password? I mean, I don't know how to get the password off my cell phone.
Yeah, that's a great question. So we had two comments. So the first one was there used to be, in case of emergency, inserts in a billfold.
Anytime you bought a billfold,
Yep.
you always had that little card.
Now
Yes.
it's in your cell phone, but if
Yes.
you can't get in your cell phone.
Absolutely. So what you could do, some things I've thought about and I've actually done with like my county phone, is put a little label. If you have a label maker at home, or even like a sticker that you can write onto, you could put that on the back of your phone between the case and the phone, or on the case itself, and write your name, your number, maybe your address so it can get dropped off. That can be really helpful. And then you could also put it on your home screen. So if you, I'm not a tech pro, so you might want to ask someone who's very into tech and well-versed in that, but I think you could put something on your home screen that says that. I think there's an emergency contact that you can actually insert. Do you know what I'm talking about?
Yeah, ICE. It's actually called like ICE, in case of emergency. And you put that contact in your phone, ICE, and then the contact, and people know who to contact. And as far as the locked home screen and the password, that's above our pay grade. We're not phone experts, so I'm so sorry. Yes, Linnea.
On my phone, I have, so it shows that my phone's locked, but has my husband's phone number
Very nice.
on the screen so that they can call him to say I have the phone, you know, to find my phone.
Well, that's a great idea. So Linnea said that on her phone she has a lock screen with a relative's phone number on her lock screen, so that if that phone is found or there's an emergency situation where perhaps Linnea can't use her cell phone, the person can call her relative whose name and number are on the lock screen. That's a great idea.
Yeah. Any last comments, questions, ideas?
This isn't very helpful for in person. This is more for online, different places to go for the resources that we use today. The Red Cross and ready.gov have a lot of stuff. This is us. Thank you very much. We're going to have an evaluation form also in the back, and we will be here in case you have any questions. So thank you for having us today, and we're here to help when you need us. Thank you. Thank you.
Thank you.
All right, well, good morning. My name is Andrew Hager. I'm the fire chief of the city of Chanhassen. So I want to say thank you for having me today, allowing us to share a little bit about our organization, the Chanhassen Fire Department, and emergency preparedness at our level. So we don't often cross paths with the public health team, so it's nice to see them, interact with them a little bit, and learn a little bit more about what they do. You know, there's very few instances that we do partner or work through issues together, but again, building community resilience is really important, and anything we can do to build those networks on the front end is very important. So before I dive into my presentation, my question is, how many people are Chanhassen residents? All right, looks like most. The reason I ask that, there are 781 fire departments in Minnesota. Every single one is different. My presentation today will focus mainly on the Chanhassen Fire Department and the programs and services that we offer. You could go 5 miles down the road to a different fire department, and it's a completely different dynamic based on staffing and what their community needs are. So truly I'm focusing on what we offer today, or the Chanhassen Fire Department offers. A little bit about the fire department before I dive into the presentation is we are an all hazards combination fire department. So what all hazards mean is we essentially respond to everything. The fires are a very, very small portion of what we do. 3 to 4% of our call volume annually is actual fires. We're staffed through a combination model, which means we have full-time people in the building and we have part-time people in the building that staff that facility 24/7. So that building is constantly staffed. There's constantly a crew on duty ready to respond to a call for service. That is a drastic change from what we've seen, and I've been doing this 24 years now, and the change in the fire service from staffing to fire behavior to community needs is evolving so quickly. We're constantly adapting and changing to overcome that. Last year we did just shy of 1,500 emergency responses in the community. This year we're on pace to do about 10% higher. We're pushing 1,600. So the demand continues to grow for our services. Mainly related to the EMS side of it, the medical side of it, which I'll talk about in a little bit. But one thing I want to highlight is I'm going to focus on community risk reduction activities today, and I'll talk about that a little further, what that means. But I think it's really important that is a value and truly part of our mission is we would much rather prevent something from happening on the front end than having to respond to it after the fact. I can tell you from, again, my years of experience, the absolute worst thing that you can do is experience a fire. You will walk out of there, hopefully safely, with 0 possessions left. You're essentially starting over. So if we can mitigate that on the front end and prevent that from ever happening, that is truly successful, in our organization. The last thing we want to do is show up to a fire at somebody's house because, again, they are devastating. We were just at one about a month ago in the community here. Those people fortunately made it out with their pets. They have 0 belongings, no home, nothing. They're starting fresh. So I'll talk a little bit about what's driving that as well. But again, in our mission statement is we want to have proactive community risk reduction activities through our service to the public and prevent these things from ever happening. And again, our value statement, again, we're preparing for this. We're building partnerships within the community, making sure that we have a purpose and we're serving the needs of the community to the best of our ability. So the topics I want to focus on today is community risk reduction programming, what that means, what you can do to prepare for an emergency, and then what the fire department does to also assist in preparation. Like I said, this is going to focus on community risk reduction. I have like one more slide that I'll talk a little bit about emergency response. We're not looking at that part of it today. This is really the crucial work that doesn't always get the true attention it deserves. We are often too reactive in our responses, and a lot of that comes down to staffing. We're very fortunate that we have 2 dedicated employees in the fire department today that their job is community risk reduction activities and programming. So they're out there doing programming, educational opportunities, identifying risk in the community, and working through mitigation to help reduce that. That is new to the fire department as of last year, so we're still getting that up and running and what that looks like. So we've got a lot of opportunity in front of us to really help try to drive down that risk and work through those hazards within the community. Like I said, this isn't the glamorous role. These aren't the putting on the firefighting gear, jumping on the truck and going out to incidents. This is a lot of the work that's done on the front end to help prepare that hopefully we don't have to do that. I'll just quickly cover our incident data for last year. On the left-hand side, you can see some response time. So when you call 911 in the city of Chanhassen, from the time that we're notified till the time we get there is just under 7 minutes. There's a little bit of lag in there with that call processing time. So it can take us some time to get there. We cover 23 square miles of the community, about 26,000 people out of one building with a very small crew. So it does take some time, and there's some things that you as a community can do in that time gap to help offset some of the risks that I'll talk about here in a little bit. So it takes us a little bit of time. I mentioned we were just under 1,500 calls for service last year. About 62% of those are medical related. So all of our firefighters are trained in the emergency medical services world, and we often respond in advance of an ambulance to medical incidents in the community. We can provide patient care, basic life support functions until an ambulance arrives and can provide advanced life support care and then ultimately make transportation to a local facility or hospital if necessary. I'm a numbers guy, so what we like to do is really look at the risk in our community. And how we do that is through a program called Urban Logic. And what that does is it evaluates our fire risk based on the incident reports that we submit. So 10 years ago, if you would have asked me what's causing fires, it would have been cooking, cigarettes, some things like that, all the generic stuff. With technology now, we're at a point where we can really drill down and I can tell you exactly what's causing the fires in this community, and we can target our limited resources towards those. So this might be a little difficult to see, but in the top left corner, we're going to assign a risk score to the community as a whole. It's a scale of 0 to 100. 100 is bad, you've got some major fire problems in your community. We're right about midpoint. We're 57 in the community today. So we're kind of in that midpoint. And then if we look down through here, we can see what's causing our fires. So our top 4 fires in the community are cooking fires, rubbish or external structure fires, so fires starting on the outside of a home. We've seen a lot of that with like landscape lighting, fireworks, things like that get into mulch and start fires. Vegetation fires, so grass fires, from often like wreck fires that got out of control, cigarettes, fireworks again, and then vehicle fires, so improperly maintained vehicles. We can even dive down a little bit further, and again, it might be kind of hard to see some of this. I'll pick on vegetation fires. Households with binge drinking habits. So that's some of the factors that are going into causing these fires. So did somebody have too many cocktails? They started a fire in their backyard. They wanted to, and it got out of control. Some of those things. So we can really drill down and find out what's going on in the community, use that data to support and drive our efforts in driving down fire risk. So again, a relatively new tool to us. I can drill this down even further then and look at it by census block in the community. So I can say the fire risk in this part of the community is significantly different than what it would be in the southern end of the community, where we're more suburban population density wise here. Where we get on the southern end of the community, it's kind of more rural settings as well. So a very effective tool for us. So community risk reduction, again, what does this mean? In my words, it's proactive fire department activities that mitigate hazards to the community. Like I mentioned, we're successful as an organization if we can prevent an incident from ever happening. And whether that's a fire, a medical incident, natural disasters, those types of events. I'm going to cover a small portion of what community risk reduction means, because if we look at this as the large umbrella, I'm not looking at new construction, fire alarm permitting, inspections. The brand new building that's going up next door, our team has spent an immense amount of time in there working through that permitting process for fire sprinklers, fire alarm systems, testing the systems to make sure they work. That's kind of a different bucket of community risk reduction. I'm going to focus on, again, those public-facing activities and where we interact with the public. So, while I run this quick video, why does this matter? And I talked about change and how quickly things change. The video I'm going to run here is from UL, a third-party testing agency. Sorry, this one doesn't have the sound. And what we're looking at is a side-by-side burn comparison. On the left-hand side of your screen is a room they constructed, and it was outfitted with I'll call it natural furnishing, something that we would have seen in houses in the 1950s and 1960s. Natural fibers, wools, cottons, those types of things. Fast forward to synthetic furnishings, where we are today, typically petroleum-based, high-density foam-based. What we see is fire behavior is so rapid and so quick. A fire now doubles, if not triples in size every minute. So if a smoke alarm goes off at 3 o'clock in the morning, it took that fire some time to already build up enough smoke to notify you. You're already delayed in responding to that incident. What you'll see here as we run this video, hopefully, I'll try it a different way. It worked when I tested this morning. All right, now it's not going to go. Oh, there we go. All right, well, I'll talk you through this. What happens is the room on the right-hand side reaches flashover in about 4.5 to 5 minutes. Flashover is about 1,200 degrees. Everything inside of that room burns, including the gases. So the smoke and the gas becomes flammable and lights on fire. So in about 4.5 to 5 minutes, it gets that far in advance with the synthetic furnishings. With natural furnishings, we don't reach flashover till we hit about a half an hour. So our time to respond to an emergency is so greatly reduced now just based on what we're putting in our homes and what we're building our homes out of. Just looking at this room, plastic tables, plastic chairs, guess what? Those are all petroleum based. The fortunate thing we have in this building is a sprinkler system. Whereas in most residential settings, we don't have that. So time is of the essence when an emergency occurs, is to act quickly. I can't put a firefighter in that room at 1,200 degrees. Our equipment that we wear does not protect us at that temperature. The face pieces that are worn on our respirators are the weakest link in our personal protective equipment. Those fail at about 392 degrees. So we can't even get close to working in an environment like that. So again, why emergency preparedness matters. Emergencies can happen anytime, whether that's fires, severe weather, medicals, natural disasters. Preparedness reduces panic. So if you wake up at 3 o'clock in the morning, you're jolted out of bed by a smoke detector, having prepared and been through that emergency plan, what you're going to do, how you're going to react, reduces that panic, brings that calmness down a little bit, allows you to think logically and get out of that situation. So having that plan increases confidence, faster and calmer decision making, and then it protects lives and property. So simple steps like smoke alarms, evacuation plans can make that huge difference in successfully navigating one of these incidents. And prepared families are safer families. If everyone has the same plan, they all know what they're going to do when an emergency takes place, that makes for a much safer family. It also supports first responders. So when residents are prepared, it allows emergency crews to respond more effectively. If you have a designated meeting spot for a fire, it's a neighbor's mailbox, it's this corner, street corner. If we show up and you tell us that, hey, everybody's out of the house, it makes a big difference on what we're going to do. It reduces strain on public safety resources. And we talked about its community responsibility, as public health talked about, that preparation really builds a resilient community. Going back to the wall that was built in Japan, that resilience really helps build a stronger community as a whole, and that's what we want to strive for. So I'm going to hit a little bit of our risk reduction programs that we do. It's just kind of some of the key programs and services that are out there. We're delivering fire and life safety education for businesses, schools, daycares, senior living centers. The question about emergency plans at assisted living facilities, I can tell you those exist. They're exercised. We get involved in helping consult with them as well. They'll invite us in and say, hey, here's our emergency action plan. We want to walk through this, and we help guide some of that. We're going to a school next week to do that exact same thing, talk through their emergency action plan and how we can partner and build stronger, more efficient plans. Quarterly hands-only CPR, AED, and choking response class. That's a non-certification program, but we run that every quarter, and I'll dive into that a little bit further down in a couple of slides. Fire extinguisher training. This is something that's changing a little bit. If there was a fire in this room today, who's comfortable using a fire extinguisher? See one hand? Again, with modern fire behavior, we still advocate if an extinguisher is ready, available, and you can use it, deploy it. However, because of how quickly fires grow, if you can't get it with that first extinguisher, you're not getting it, so then get out as quickly as you can. So we do offer some training programs for that. We're interacting with the Scouts programs that are out there, special presentations to partner with law enforcement, and Community Connect, which I'll talk about here in a little bit. So some of our key programs or events that we're participating in then is actually partner with public health now and do a car seat clinic every year. So we invite the community into the fire station and have car seats inspected to make sure they're properly installed, again, with the goal of preventing an incident from ever happening. Now, that's the younger crowd, obviously, the children that are utilizing those, but the data's finding that about 75% of car seats are installed incorrectly. So we want to make sure that they're installed correctly. In the event there's a crash, that seat functions and performs as it should. We host a safety camp in the summers. We talked a little bit, I think the Night to Unite topic came up maybe with homeowners associations and building those partnerships with your neighbors. In August of this year, the fire department visited 27 different neighborhood parties throughout the community. We are very busy, but it's very fun to do, and we get to go out and meet the community as well and help build some of those relationships, share some of this information, so it's an important event for us as well. We have our annual fire department open house at the end of September, which I'll talk about here in a little bit. Toys for Tots drives and various food collection and food shelf drives that we do as well. So that's just a highlight of some of the community risk reduction programs that we do. So what can you do to prepare for an emergency? The first one I'm going to talk about is this Community Connect program. There's a big poster over here that they made up that's got some of the details on it. There's postcards in the back with this flyer. But this is an opportunity for you as the public to share information with us pertaining to your family, your property, what critical components may come in related to an emergency. And you're entering this into a database, and I'll show you a little bit what this looks like, but it allows us to be better prepared when responding to your property. So what can you share in this platform? Your property. So what is it? Is it a home? Is it a commercial building? This is available to all of the properties out there. Talked about, are there fire sprinklers? Where's your designated family meeting space? That helps us make better decisions even while we're traveling to an incident. You can tell us about the people that reside in that house. Whether that's emergency contact information, that if there's an event, we can reach out. If you're out of town and here's the phone number for this house, we can reach out and share, hey, we were at your house for an alarm call or something like that. Just helps us communicate better information as well. You can let us know about any needs within the home. So if you've got functional needs with a family member, mobility needs with a family member, somebody that lives there, that really helps us, again, in the event of an emergency. If we know that there's somebody in there that's non-ambulatory that may take 3 or 4 people to help get them out of the house, that's pretty important information to us. The topic came up several times in the first presentation, but pets, right? They're a part of our family. So you can tell us about your pets. You can tell us how many dogs or cats you have in there. You can put their names in there. You can even put pictures in there. That information all becomes available to us, and I'll show you what that looks like a little bit. Now, in the world we live in, is your information safe? I'd like to say yes. The program that we're using essentially uses the same bank or encryption level like that banks do. So it's as safe as your financial information is. Now, that's not very always reassuring in this day and age because there's always somebody out there that's ahead of it, but we're taking this seriously, and we want to make sure that the program that we use to facilitate this is safe. It's also voluntary, so if there's something you're not comfortable sharing, you don't have to. You put as little or as much information into this program that you want, that you're comfortable sharing. So you get to kind of tailor to what you're comfortable with. And then again, this is private. It's only used by us in the event of an emergency. So what does that look like? This is just a quick screenshot. What would be accompanying this is a map of where the location is and everything like that. But what we get is we get tiles on our iPads and our fire trucks. So this pops up. It's right in front of the firefighters. In this situation, we're going to see that we highlighted this tile, which is Community Connect. So this came in from a user. They indicated they have pets in the house, a cat, a reptile, a large green lizard named Chip. So all of that information becomes available to us. We're going into this house. Now we know that, hey, there's a cat and there's a reptile in this house that we need to be on the lookout for. Same thing. I didn't highlight all of these, but Community Connect meeting place. So if we clicked on that tile, it might say the meeting place is at the neighbor's mailbox or at the corner of 5th and Main or wherever that is. So when we're coming into an event there, we know now to look for that meeting place and see if people are there. So again, just providing some really valuable information to us on the front end of an emergency response. So how does this work? It's simple. You create a free account. You need an email address, a phone number, and a physical address. You put in as much information as you want or you're comfortable with, and then again, that gets pushed over into our platform. There's, like I said, there's flyers on the back to sign up for this. There's some stuff up front here as well, or you can find this on the City of Chanhassen's website. Now,
I filled one of those out, and I'm just curious, I don't remember all that I put in there. Is there a way to go in and update if anything's changed or?
Yeah, so great question. The question was if we've created a profile already, can we go and update that? The system's actually smart enough that it will email you a reminder every year to say, hey, update your profile. If something changes prior to that 1-year enrollment date, you can go in there at any time and make the updates that are necessary. So, yeah, that's the other thing is we got to make sure the information stays consistent or relevant, right? Things always change, so we want to stay ahead of that. So this is a new program we just launched, I think, last fall, so we're really excited to continue to build this one out. So, public health hit on this one already, so you're hearing it twice, which means it's important. The Carver County Citizens Alert System. So at the city level, we don't have a mass notification means. So, weather alerts typically are generated at the county level. The National Weather Service will put Carver County under a tornado watch, tornado warning, whatever that is. Again, you can sign up, opt into alerts. You can check as many boxes as you want or as little boxes as you want to get the information that's important to you. So that's how you can get to that one. Again, the county website is also a great opportunity to do that. Smoke detectors. Again, some action you can take. Anybody have a guess on how many false alarms? So of the 1,500 incidents we went on last year, what percentage of those were false alarms?
85%.
How many?
85.
85? Well, a little lower. 4? A little higher, about 12%. So about 12% of the 1,500 calls are false alarms. And a lot of that has to do with people not knowing what smoke detectors are trying to tell them. These devices are very smart. We have to be able to understand what they're trying to tell us. So a couple of things I want to highlight. Smoke detectors are good for 10 years. 10 years, they're junk. The sensors go bad, throw them away, buy new ones. How do you know how old it is? Right here on the back of a detector. This one was February 29th of 2012. That's past 10 years. That should be disposed of and be replaced. The other nice thing on the back of detectors is they will tell you right here what they're trying to communicate to you. So this specific model, if it beeps 3 times, it's a smoke alarm. If it beeps 4 times, it's a carbon monoxide alarm. This is a combination detector. If it chirps once per minute, it's a battery. If it chirps twice per minute, it's a malfunction and it says replace the alarm. And if it chirps 5 times a minute, it's past the end of its service life and it should be disposed of and replaced. So like I said, very smart devices. They're trying to tell us, hey, I need attention, do something about me. We often get called on 911, my smoke alarm is going off. So we have to send a fire truck out there, right? Somebody called 911, they need something. We send a fire truck out there, it's chirping once a minute, the battery's dead. So again, going back to preparedness, if we can prevent those types of incidents from happening and preserve our resources for the true emergencies, that's really important to us. Where these should be located is outside of sleeping areas. So we should have one on every level and they should be outside of or in sleeping areas right at that point. Ideally, they're interconnected so that if one goes off, if a fire starts in the basement, it sets all of the detectors off. Now, some of the older houses that are out there, they don't have that technology. So, you know, something is better than nothing at that point. We are seeing now with the development of lithium-ion batteries, which I'll talk about at the end, but we can put we can buy a sealed detector now that has a 10-year lithium-ion battery in there. The battery lasts as long as the device. 10 years is up, throw the entire thing away, start over. You don't have to try to climb up on a 12-foot ladder and change batteries. Ideally, we're changing batteries twice a year on these things. Again, daylight savings time is a great opportunity to do that. Set your clock back, change your batteries. Carbon monoxide detection. So this is, you know, a significant hazard in Minnesota because we burn fuel for heat in the wintertime, right? Give it a month or two here, we'll start firing up furnaces, and we see a big uptick in carbon monoxide alarms, which is good because that means the alarms are working, but same thing as the smoke detectors. Just because they make a noise doesn't mean there's a hazard. So same thing, on the back of these, there will be a guide. If it chirps once, it's this. If it chirps twice, it's this. So kind of know your detectors, know what they're trying to tell you. This is a colorless, odorless, tasteless gas. The only way to know it's in your house is through a detector. And it's caused by incomplete combustion. So something isn't burning clean and it's giving off this gas. We want these installed within 10 feet of all sleeping areas. Again, especially at night, you're very vulnerable to this if an event happens. And symptoms start off as headache, dizziness, kind of present themselves as a flu. If it goes unchecked, it can lead to death. Carbon monoxide binds to the blood and prevents oxygen from being delivered throughout the body. There is no way to reverse those effects if it gets too far past. We can't do CPR, we can't put you in a hyperbaric chamber. Once it gets to a point that it's irreversible. So early detection and warning is crucial in this. Like I said, we typically see an uptick in calls during the heating season. For some reason, we see a shorter life in these, typically like 5 to 7 years, and the detector or the sensor in the detector fails and they have to be replaced. So those are some big key elements: working smoke detectors, carbon monoxide detectors, sharing some of that community connect information that really are some simple steps that you guys can do to help be prepared. So what can we do to help you and assist in this preparation? Home fire safety inspections. So this is a new program that is tied to Community Connect. If you want a home fire safety inspection, you can request that through the Community Connect portal. When you log in and you create your profile, there's a little button that says request inspection. What we will do is we'll send our team out there, we'll conduct a fire inspection of your home, and we're going to produce a written report with best practices to help you mitigate hazards in your home. The fire code allows me to walk into any commercial building in this community and conduct an inspection whenever we want. The fire code does not give us that latitude in residential settings, nor should it. That's your private space, and we want to respect that. You can invite us into your home, though, and again, we can produce this report. It's all voluntary. There's no fines. There's no punitive damage. We're going to hand you a report that says, hey, here's our best practice recommendations to improve safety in your home. So if this is something you want to take advantage of, again, our team will come out and produce that report for you. That service is available through Community Connect and making a request right there. CPR. So a hit hands only CPR training. So this is a program we run quarterly. That CPR fills a crucial gap in patient care until that basic life support or advanced life support care or service can arrive. And as I talked about in one of the opening slides, we're upwards of 7 minutes right there. Survivability rates decrease 7 to 10% for every minute that goes by without an AED being applied to that patient. Unfortunately, when these events occur in public settings, the individuals don't get the help they need because people aren't trained or are worried about maybe doing something wrong. So the people just often don't get the care they need. So we want to be help advocate for providing that training and getting people the skills that they need to act in the event of a cardiac arrest. This is about an hour-and-a-half long class. It's open to anyone that wants to sign up, residents or non-residents. It's held at our fire station. There's no charge for it. One of the things that's changed drastically over the years with CPR is there's no mouth-to-mouth anymore. That's not a thing. What we want is it's 2 simple steps. You call 911, you push hard and fast on the center of the chest. The body, when it goes into cardiac arrest, has about 8 minutes of oxygenated blood in it. What we're seeking is somebody to move that blood, keep that blood moving throughout to get to those organs until, again, advanced care can arrive and we can provide that patient care as necessary. So we've got a class coming up to October 22nd and January 7th. There's a QR code on the screen there. I can always go back to this as well. That's how you can sign up, or directly through the City of Chanhassen's website. You can sign up for that class as well. Talked a little bit about fire extinguisher training, but this is a program we offer to community groups and businesses. Unfortunately, we don't have any individual setups right now, but we invested in a virtual reality trainer for this. So if you want to put these goggles on, it shows you like a real fire. You have an extinguisher in your hand, and it runs through different scenarios where you may not be able to put the fire out. So at that point, your fire extinguisher just ran out, the fire's still burning, it's growing. Guess what? You better turn around and leave. So we've got that virtual reality training opportunity to really help provide that realistic environment for what a fire may look like and how to extinguish it. The Knox Home Box program is another program we offer. I've got some flyers on the back table for this one as well. This becomes really beneficial where we have individuals maybe living on their own, or back to the first scenario that public health threw out there is somebody fell, they couldn't get to the door, maybe they can't get to their phone, but they need help. And how do we get in there to help them? So you as a homeowner can buy one of these key boxes. It gets mounted on the exterior of your home, typically on the front door, whether it's screwed to the door, like the one pictured here just hangs over the top of the door. And our firefighters have access to that via master key. So, a building like this, the new building next door, they all have to have a key box on it per code. And that same key that gets us into those boxes gets us into these home boxes. These are a little bit smaller. They have room for a single key in there, so you can leave a key for your front door in there. And again, fire department responds. If somebody's incapable of coming to the door, we can access that house without having to force down a door or break a window or something like that to expedite entry into that home and provide that care. So again, flyers on the back for that. And we talked a little bit about emergency management functions. Again, at the city level, the fire department is responsible for maintenance of an emergency operations plan. So the city of Chanhassen has an emergency operations plan that says what we're going to do in the event of a disaster. And that covers all threats from severe weather, tornadoes, severe thunderstorms, winter storms, flooding, all the way down to man-made events, or what we're seeing now is active shooter incidents, those larger disaster events like that. So we have a plan that we exercise annually with our city staff to help them be prepared for that as well. So, last year our entire city staff leadership team sat down and we simulated a tornado went through the city. How are we going to respond? How do we maintain services, which rolls into the continuity of operations plan that we also manage to ensure that, yes, we're dealing with a tornado on the southern end of the city, but business as usual has to go on elsewhere, and how do we manage both of those incidents? So the fire department is heavily involved in that and oversees all that. And then we also maintain the city's emergency outdoor warning siren network. So as public health had talked about, again, those are tested first Wednesday of every month at 1 p.m. They're to notify people outdoors of inclement weather. I get many phone calls every year. I didn't hear the tornado sirens in my house, and I said, yep, that's how they're designed. They're designed to warn people outdoor, that may be outside. In your home, the desire is, that notification is done through TV, radio, cell phone, any other means like that. But those systems just aren't designed to notify everybody within the house. And then event planning. So the fire department itself is in charge of reviewing all large-scale events in the community. So through a permitting process, we're looking at all of these various events that take place. We're providing feedback on best practices for how to get responders in, how best practice for I'll use the July 4th event that takes place in the city here. The fire department spends about 3 months working through a plan and developing a plan for that. In the event that something bad happens, whether it's a weather event or something related to that we're best prepared for that. So that consumes a significant amount of our time as well. And then I talked about we're reviewing emergency actions plans alongside businesses and other groups. Like I said, we're going to a school next week to kind of look at some of their plans and provide feedback as well. So we get pretty heavily involved in a lot of that. Our fire prevention house, as I mentioned, is at the end of the month here, 5:30 to 8 at the fire station. So we'll have a live fire demonstration, spray house, educational displays, and we've got a helicopter coming in to visit this year as well. They'll just be there from 5:30 to 6 p.m. So we'll land a helicopter on the fields right behind the fire station here and let people check that one out. And then we're collecting donations for Southern Valley Alliance on behalf of the community for that one. So that's a great event for families as well that come check out. Another really important one, and this is just such a great example of how important it is to sleep with your doors closed. So there's a campaign out there called Close Before You Doze, and it's to minimize how fire can travel within a home. As we've seen construction kind of evolve, a Rambler that was built in the 1950s was very compartmentalized. There's hallways, corridors, everything like that. What we're seeing in modern construction, again, is these large open spaces. So 2-story vaulted ceilings, large rooms. That creates a really bad environment for fire growth. Kind of, helps drive some of that speed of fire growth as well. The pictures that you're seeing here are from an incident in the city about a month ago. On the left-hand side, what you're seeing is the door separating the kitchen from the garage. You'll notice just some soot staining around the top of the door here, but damage to the house inside of that room is nothing. If I open that door, so now this is the door open here, that's the vehicle inside of the garage. This is actually the roof of the garage here that's fallen down. There's a hole burnt right through the roof of that garage. That $150 cheap door held that fire back from entering that home. So again, what we're advocating for is when people go to bed at night, you close your door to prevent that same thing.
What started that fire?
That'll be one of my very last slides that I talk about, but lithium-ion batteries. And I'll get into that a little bit further because that's the next big hazard that's coming. Question was, what started the fire? Lithium-ion batteries. So again, a simple step like closing your door before you go to bed every single night can reduce, where that fire goes, how it travels, and provides you, a safe haven or a refuge spot in the event of a fire. I've got some of these in the back as well, but another program we run is called File of Life. So it allows you to have important medical information readily accessible to responders in the event of an emergency. So this is a little magnet that you stick on your refrigerator typically. There's a piece of paper in there and you fill out medical conditions, medications, allergies, emergency contacts, any type of that information. And then again, if we show up to your house, that's information we can grab and it ultimately gets passed on to the hospital through the paramedics, and then they know how best to treat you. So we're always on the lookout for these. It's a nice red file, like I said, typically right on the refrigerator, and keep that information up to date as well. You know, one of the things that happens in like a medical event is you get asked a ton of questions. Typically the fire department's going to arrive, we're going to ask you a whole bunch of questions, the paramedics are going to arrive, they're going to ask you a whole bunch more questions. We're trying to gather as much data as we can to help care for that patient, and ultimately all of that gets passed on to the hospital so that they can provide the best care. A lot of it even goes in advance. So the paramedics now show up, they've got an iPad they're typing all this stuff into, it's going right into the hospital system. So the doctors know, who's coming in and what information is available as they are being treated on the scene. The last program that I'm really excited about, and it's not even out there yet, but we're getting ready to launch this quarter, will be an AED lending library program. So I talked about public CPR and how important that is to fill a gap in that chain of care. But beginning later this year, the fire department will maintain an AED library program where the public or the community can come in and check out an AED to have on hand at a large gathering or something like that. These devices now are so smart, and this is the actual one that we're buying for this, is when you pull that red handle, it says pull to start. It does a couple of things. It calls 911 for you. It sends GPS coordinates of where you are to the dispatch center, so they know exactly where this emergency is taking place. And a video will pop up on the screen and walk you through how to use this thing. So it is a really, really easy device to use. But again, our goal here is promoting greater access to public AED use until that advanced care can arrive and provide additional options for care as well. So really trying to fill in that chain of survival for cardiac incidents.
What does the AED, I'm assuming it's emergency device, but what is the A?
Oh, that's just the brand name.
Okay.
This one?
Yeah.
Automated external defibrillator. So yeah. Yep. So again, that is the only true treatment for sudden cardiac arrest. Is we have to shock the heart back into a rhythm that's sustainable. We can do CPR as long as you possibly want. Again, that's buying time until one of these can be applied. But the only fix for sudden cardiac arrest, besides getting to a hospital, but the only fix that we can truly do in the field is applying one of these devices and delivering that electrical shock to kind of restart the heart. So this is a program we're really excited about, and we think it'll have some great impacts across the community, and it's coming later this year. So we just secured grant funding for it to get this one rolled out. So, all right, our next big hazard. Who has lithium-ion batteries in their home?
Like in a laptop?
I hope every single one of you raises your hand. Have one of these? Yep. Lithium-ion batteries are great on the capacity and the energy that they carry. They are very bad when they're damaged or ultimately start on fire. What happens is a Tesla, for example, a Tesla vehicle, there are 3,000 individual battery cells inside of the battery pack that make that up. If one of those cells is damaged, and it could be related to manufacturing issues, it could be just physical damage, it got hit or struck, it could be it got overheated, it goes into what's called thermal runaway. And these batteries have a battery management system on board, which helps cool the battery and keeps it in check. But if they get too hot, the battery management system can't keep up, and the battery goes into what's called thermal runaway. One cell will burn, the other cell will burn, the other cell will burn until all 3,000 of them burn. When these start to burn, they can burn upwards of 5,000 degrees, and because it's a chemical fire, they create their own oxygen. We can't put these out right now. very effectively. Large volumes of water will not put these out. We've seen some of the EVs out there burn for days, if not weeks, after they put 100,000 gallons of water on them. So it's a huge, huge issue, and it's not just related to cars. It's all the way down to your cell phone, your watches, everything like that. One of the big issues we're really seeing is if you have an iPhone and you want to go buy a charging cord and cable from Apple for that, they're probably going to charge you about $40, right? And you're thinking, I can go to the gas station and buy the same thing for $3. That is where we really kind of run into issues, is the cheaper cables and charging components that are out there aren't certified for that device. And they introduce heat into the system, and that can lead to a fire as well. So our advice is invest in what the manufacturer says, because they tested it to get to that point, and that is the safest piece of equipment for that phone or charger or whatever that is. This is a huge, huge issue, and it's only going to grow. Tesla just recently announced that they are releasing a Model 2 EV that's going to run for about $17,000. So you're going to be able to go buy a brand new electric vehicle for $17,000. What do you think that's going to do to the market? It's going to get flooded with these. And again, as the fire service, and it's not just a problem here in Chanhassen, it's the fire service everywhere, is we do not have a great mechanism to put these fires out right now. And again,
is there any way to test that you don't have damage on your batteries?
Like a physical inspection is good. A lot of times what we'll see is when, if you see any denting or anything like that, the just visual things like that, when they are damaged or they're exposed to heat, they'll typically swell as well. So they'll get bigger, and maybe if it's a plug-in style battery, it doesn't fit like it used to. That's a really good indication that it's failed. So the question was, is there a way to inspect it for damage? We have a drone that we operate for the fire department, right? It goes up in the air, flies around. It's got these lithium-ion batteries that are really, really high energy output, but they get so hot that they swell up, they don't fit in there anymore. And again, even we know that that's the time that those have to get replaced. So, yeah.
Is there an alternative to lithium-ion batteries?
Question was, is there an alternative to lithium-ion? No. The kind of the market is everything's shifting to this. You can still buy your AA, your AAA batteries in the nickel, I don't remember what they are, like lead acid, those types of things. But everything now is shifting to the lithium-ion battery. If you go to Home Depot and buy a new drill or something like that, it's going to be a lithium-ion battery, and that's really the only choice you're going to have. So they're really good because they provide a ton of energy and runtime for their devices. But when they do get exposed to damage or are involved in a fire, they produce some significant hazards. Yeah. Great question. So if you replace the battery, what do you do with the old one? Carver County Environmental Center over in Chaska can recycle all those types of batteries for you. So, all right, I'm going to run this video. Looks like it's going to work. So what we're doing in this video is we're overcharging a battery on an e-scooter, and we've got it right here sitting in the home. I'll say pay attention to this infrared camera view down here. And what you'll start to see is the battery will off-gas first. So it's trying to cool itself prior to it starting on fire. So between like this one and this one, you'll see some puffs of smoke start coming out of here as this thing is being overcharged, essentially. So this could be, again, we bought a not original manufacturer's charger, something like that. We bought the cheap charger, and that's just not compatible with that battery, and it starts to introduce some problems. This test that was done inside of a house. What we're not seeing a ton of, but like out in New York, these scooters are everywhere, and they're storing them in apartment buildings, in hallways of apartment buildings. So right there, you can start to see some gas coming out of that battery. And same thing, you'll start to see it puff here, and they take off that quick. Again, temperatures when that happens upwards of 5,000 degrees. It's an instant flash fire as all those cells now have to burn, and all that energy that stored energy has to be given off. So you'll see, again, now this is kind of that entry. Here's your living room. through here, you can see how quickly that fire takes off and grows. And in the bottom right corner, we've already seen the windows are blown out of this house as a result, and the flames are coming out in less than 2 minutes. And we start to lose all of our cameras at this point just due to the fire growth as well. So great, like I said, for energy delivery, but when they are improperly used, misused, damaged, they produce some significant hazards to us. So, question?
How long do they burn?
How long do they burn was the question. That is very dependent on how many cells are in there. So I talked about the Tesla having 3,000 individual cells. There's enough fuel there to burn for about an hour straight. And actually what happens is if we put water on there, it actually slows that process down, so then they'll burn even longer. So, you know, something like that scooter that they showed, that might be a 20-minute burn or something like that. But when we get into like the vehicles, significantly longer. Question?
How do you know when it's overcharging? Like when do you know that it's finished charging and you need to unplug it? Is there
Yeah.
a warning or anything?
Great question. So it was, how do you know when it's finished charging? I'll go back to the pictures I showed you of the fire we had about a month ago that was caused by a lithium-ion battery. That battery sat on a charger all the time. So best thing you can do is follow the manufacturer's recommendations. If it says charge for an hour or whatever, you know, that may be, as soon as it's done charging, pull it off that charger. Don't let them sit idle on the charger all the time. You know, most of the chargers will tell you, you know, there'll be a blinking light on there, it blinks green or something when it's done. As soon as that battery's done, remove it, you know, leave it sit on the shelf. But having it sit on a charger constantly can produce some challenges with failing. So, yes?
How far do they spread without, how far do the fires spread without anybody having one of them?
How far did the fire spread?
Yes.
So you kind of saw that it kind of exploded initially, right? It spread over that entire room. And because of the gases that come off of that, those gases will also feed the fire, so they'll spread throughout the entire house really quick. So, yes?
Would it be smart then? I've got an electric lawnmower or weed whips, all of those are lithium. Is it better maybe to use like an outside outlet and charge them outdoors in case you can still keep track of how long it's been on?
Yeah.
Like, they usually, when you plug it in, then the little light will turn red, and then when it's ready to go, the light will turn green. So then I would know to unplug it, but would outdoors be better than in a...
So, yeah, the question was would outdoor charging be better? Potentially. You know, my preference is I only charge a battery when I'm around it, that I can see it, just so that, you know, I won't leave a battery sit on overnight or something like that because you don't know what's going to happen. And so my preference is I'm around it, I can see it when I'm charging, and then when I'm done. If that fire started on the outside of the house, again, with modern construction, fire behavior, that's going to run right up the side of the house pretty quickly too. So, I mean, it probably gives you a little bit better time, you know, that it's not happening inside of a house to get out in the event of one of these incidents. So, yes?
If the battery is not on a charger, I have a cell phone and a phone, and I've noticed that it's
Starting to swell?
Yes, but it's not on the charger right now. Is there potential for that battery to explode, catch on fire if it's not charging?
Yep. So the question was, can a battery still explode or start on fire if it's not charging? And the answer is yes. If that battery pack is somehow physically damaged, that risk is still there. So, and you know, one of the other things that we see is, you know, a battery in a device fails. What do we want to do? We want to jump on Amazon. We want to get something that's going to be here tomorrow for the cheapest price, right? Oftentimes those come from overseas, and the quality or the standards aren't there that would be associated with that original manufacturer. So we don't know where that's being made, who's making it, so that poses some challenges as well. So again, trying to utilize original manufacturer's equipment is really important for this. So, yeah. Yeah, the question was like around a laptop, if it's plugged in, that risk still exists. You know, right now, like this laptop's plugged in and it's charging.
Yeah, my laptop's plugged in all the time.
Yeah.
So I should unplug it.
I mean, that's what we're starting to see is that this is going to become a bigger and bigger issue here as these batteries, you know, start to show up in more and more things. So.
And it's smart to unplug the charger. I mean, like, I keep my chargers plugged in all the time and then plug the phone into it. Is it smarter to just unplug the whole thing?
Yeah, the question was.
It does generate like a little bit of heat.
Yeah, the question was, should we unplug the charger? We really don't see many issues with the chargers themselves, if there's not a load connected to it. So when we get the load on the other end is where we really start having some issues. So again, this stuff is really, really new. I mean, lithium-ion batteries have been around for a while, but as more and more of them pop up, this stuff is starting to come out. I mean, this test was like from 4 years ago, I think, but they're doing a ton of work on trying to figure these things out on the fire side and how we can respond and extinguish these. So we're going to see more and more of this. We want to, again, be on the front end of this. So this is one of those things that's going to change very rapidly. So, questions for me? Yes, sir.
Where did you make that test?
I didn't make that test. There's a group of scientists out there that research this stuff. I think that test was done in New York. But there's a group of people out there, it's called the Fire Safety Research Institute through Underwriters Laboratories, and they're looking at all the science behind this stuff. So I know just last fall, they lit 12 different electric vehicles on fire to see how they burn, how things go, and they're doing all that testing to support the data and the science behind this. So.
Also the premium rates.
What's that?
The insurance premium rates.
Yeah, yeah, the insurance premium rates. Yep. So that's going to be another thing is the insurance side of it. So, yes.
For the chemical burns that we're seeing more of, you know, the hazard, like you said, you're all hazard and then Chanhassen here. Is that causing more cancer in our firefighters? How can we support that? You know, anything needs to be done.
Yeah, great question. So the question was, is cancer higher in the fire service? And the answer is yes. We, as firefighters, we see an elevated risk of cancer. Nobody really has a great number of what that is. You know, it's anywhere from 14 to 30% higher cancer rates in the fire service. And that's a lot of what we're exposed to through this. We've changed a lot of our practices as a result of that. You know, years ago, people didn't know that. They went into some of these situations where they're not wearing respiratory protection. They felt they didn't need it. The culture has really changed around that. And our equipment's getting better to support that, but that risk is still out there. You know, we've lost a firefighter just in Victoria about a month ago to cancer. There's been several others that have been lost to cancer. And it's a big issue. So there's not a great solution to it right now. There's some works in legislation around that to try to address some of the issues through law and stuff like that. And like I said, in organizations, we're working through that as well to change our operations and how we respond to some of that. So.
One thing I wondered if we could have some kind of more community service things where maybe like firefighters and police officers, nurses could, you know, rotate after 5 years, 10 years, get a new batch of young people trained to start preserving the lives of some of you guys, you know?
Yeah. Yeah, so the question was, or a comment about reducing or rotating people throughout positions to, you know, help take some of the impacts off of the stress of the job, essentially, right, is what it was. So, yeah, I mean, our folks typically are those first responders to a lot of those incidents, and I can tell you through conversations with some of our people, it impacts their mental capability, and it's a very challenging job. We have a lot of resources out there for people to help navigate just internally for some of the stuff that they deal with on a daily basis. So. Yes?
Where did the scientists leave the 12 electric vehicles on fire?
When did...
Where? What place did they leave the 12 electric vehicles on fire?
What place?
Yes.
It was a group called Underwriters Laboratories, so they do a bunch of testing. And they did it somewhere in New York. I don't know exactly where, but so they test a lot of that information. So, yeah.
When you mentioned about checking the, getting the quality reports, the UL should be on there to know that it was tested by under our Preparedness versus the things like, say, a $3 quart at a gas station is probably not going to have a UL rating.
Yeah. So the comment was getting a quart or device that's got a testing agency associated with it. So UL's the big one out there. You'll see that their stamp right on the box or the packaging. CSA is another one, but some independent third-party testing laboratory. They've taken that product, they've put it through the testing requirements to make sure it's going to function and to the safety standards that are out there. So, great comment.
What was the second one you said? UL and then?
CSA is another one. We'll typically see that more in Canada, but just because we're in the northern part of the country, they'll end up here once in a while as well.
A lot of those like power strips. Yeah.
Yep.
The ones I have don't say it, so it's like, okay, I'm not going to use them.
Yeah.
So I bring them to the environmental center because I think they could use the copper out of it, but yeah, I don't want to use those in my house unless they're UL.
Yep. Yeah, make sure, again.
But now CSA is also.
That's another one, yep. Yeah, UL's a big one out there. It's probably going to be on 90% of this stuff. So, yes? What's that? By who are we funded? Your taxes. So our organization is 100% funded by the property taxes that the city assesses on all the property owners. And then we do have some grants and stuff like that available to us to help with some of the other programming and needs, but essentially 100% is taxpayer funded.
On your presentation, you guys do a lot of things for the budget, like increase as well. So I wonder if it's being made by the city.
Our budget is definitely increasing. I would say the increase in our budget right now is being driven by the increase in call demand. So I kind of alluded to, we have about a 10% increase in calls annually, and trying to keep up with that, typically through people and wages, is kind of where we're seeing the bigger increases in our budget. So. What's that?
Is it being met by the city?
Is it being met by the city? Yes. But again, knowing what's coming, we're having some of those conversations right now with like city council about what does this service look like in 5 years? Because what we're doing today. How much is a fire truck? Who's got a guess?
300,000.
Million? About $1 million. Yep, so a fire engine right now is 1 to 1.2 million, somewhere in there. If we get to like a ladder truck, those are upwards of $2 million right now. So to your question about, is it being managed by the city? Yes, but we also recognize there's some challenges associated with that because.
Do you need another fire truck at the station?
The question is, do we need another fire truck? Not right now. We do have a scheduled replacement for a fire truck coming up in about 3 years here. So we'll replace an existing one, but we're not adding any additional new ones right now. As I mentioned, we're engaging city council right now in some conversations around what does this look like in the future? Because if we stay on this 10% growth increase every single year, within the next 5 years, we're going to have some significant challenges with staffing. And we know it's coming, so let's get ahead of it and let's start preparing for it so we can ensure that we're still meeting the needs of the community. So, great question. Yes?
Are there plans for a third fire station? Right now, we have one at Minnewaska and this one.
So the question was, are there plans for a third fire station? So, yes and no. So that's kind of part of that strategic plan of where this service delivery is going. About 4 years ago now, the Minnewaska fire station was actually shut down. So it's not operated as a fire station today. It is leased out to Ridgeview Ambulance Service, and it's being utilized as an ambulance base. In turn, then, full-time firefighters were put in the building here to respond to the entire city. Again, we know that model will need some tweaks coming in the future here, especially as the community keeps growing and the growth seems to be concentrated probably more on the southern end There's a lot of growth potential on the southern end of the community. So we're starting to have some of those conversations right now, actually next month with City Council about what does this look like and where do we need to go with it, and we'll start working on kind of that 5 to 10 year plan to make sure that those resources are in place. So, any other questions for me?
Yes, when are those conversations going to take place?
I think so. We had a workshop in May of this year with the City Council. The question is, when do the conversations take place? I think the next one that we're queued in for is October 13th with the City Council, and just have some conversations around. It's more sharing some of the information with them about some of the stats that I talked about earlier and future growth projections and where this is going. So we'll have those conversations with council, just so, again, when budget requests come in the following years, they know what the ask for and why that need exists. So, all right, anything else?
Fantastic.
Yeah. Well, thank you. Thanks for having me. So.
Can I say wow? That was valuable information, and I hope that we'll share it with everyone we know, and we'll share it online, of course. And for those in the room, please do stay and take some time to look at the information here and take all the information on the back table with you and pass it along, because a big part of communities of belonging is sharing and talking with our neighbors and taking what we learned today. I'm going to run home and start talking to my family about all of our devices, and I hope you'll do the same. So thank you for coming today, and like I say, take your time. Don't feel like you have to rush out of here. We have plenty of time. And thank you to Scott for recording for us, and to all of our speakers for taking the time on a Saturday morning to be here with us. Thank you. Have a great day.